All right, ladies, let's get to the business at hand here. We're looking at photos that Lynn took yesterday of a gorgeous sunrise over where was that? Over Atlantic Beach,
Emerald Isle.
Emerald Isle,
yeah,
nice,
absolutely gorgeous.
I always like to welcome our senior moment in our segment we do each Friday morning here with our friends from Carteret Landing. Lynn Schultz in the studio again. Welcome, Lynn.
Thank you.
Your old hat at this, and speaking of old hat, Pat Wesson.
There you go. Yay.
Nice segue for that.
I am the old.
The original, the original senior moment spokesperson here. So welcome back, Pat. It's good to see you.
Thank you.
Good to see you.
Nice meeting you. And here we go.
Here we go again. So Pat knows how the game is.
Dressed up for you today.
No jammies.
No jammies.
Well, tell Pat, if you would, tell the audience where you are today, what you're doing, and what brings you into the studio this morning.
Well, I worked for a large company for quite a while as a marketing person, and when that downsized, I came home and I go, oh my gosh, I might be old, but I'm not ready yet. I want to keep sparkling. So over the years, I had developed through this program and everything on the radio a large resource connections throughout everything, and not just in the healthcare industry, but somebody to mow your lawn, to put up the safeties. And I thought, all those years I gave away all this information free. Now I don't have a job, I need to start a job. So I started Senior Resource Connections, and what I am in this area is called an elder care navigator. So I navigate adult children. Maybe they don't live here. I have clients, adult children who are my clients from Washington State to New York City, and they just need somebody to guide them and what to do in this area. And so that's how it started. And it can be a huge business, because this is such a senior community in this area. And a lot of people came to the beach, and that's where they retired, and now their children are all over the country, and they need help. Not only children, but adult children, but even seniors, loved ones, when it starts. And so I sort of put together a care plan for them and guide them, and that's how it got started. And it's something that's really needed in this area, and so that's how it worked, and so it works out really well. So people see me. I just had someone Google me. I said, that is a scary thing.
Oh,
I didn't know everything that you ever did in your life.
It's out there,
Google.
Pat. There's no secrets.
True.
For me, it's a little scary. So that's how it goes. So I start out, and it just puts me in touch with a lot of resources and people and help them. And so that's how it is.
Definitely needed, because I get so many calls of people saying, where do I start? I mean, they have this, mom and dad need help, and it's not something you think about. It just kind of grows up on you real fast.
Right, especially, they look at it, and know that they don't realize their mom and dad or whoever their loved one is in trouble, so they come home for the 2 weeks at Christmas and go, oh my gosh. And so all of us have jumps in our healthcare business in the fall and summer, in the winter and summer. So that's how it goes.
So what you mentioned there, Pat, it sounds like a very broad topic. So I like the last example that Lynn illustrated there. Suppose a person of our age comes home and sees our elderly parents, and we don't see them a lot, and things change. We come into the home, and I think mom and dad need help, or maybe just mom needs help. Dad's out of, dad's passed away and all that. So how do people contact you? And then what are the first questions you ask to try to find some sort of remedy to the situation that the children are seeing? I mean, do you get them into like support groups? Maybe something working in the home with a caregiver. Maybe it's something as like even as simple as a service. Well, not simple, but getting a service animal for the parent.
And that, bringing up service, but that's exactly what it is they call me. They might have called the senior center, or they call one of the facilities, goes, oh my God, they just call something, they think health department, they refer to me, and then I start the process. And the first thing I need to know is all about what level are we on, and what are we dealing with, like you say, in home or out of home. And in this been a crazy time with the pandemic, on not being able to go into the facilities or checking on people that are in the facilities. One facility, I must have 6 or 7 clients that I can check on over there. But so that's what happens. But I wanted to talk about, you brought up service dog, and that is something that came out of the blue. So this is kind of weird that you even mentioned it, because right now service dogs are not being able to go into the facilities at all or to the hospital, and they need to work.
Yeah.
Service dogs have been trained for that. It wasn't even a week ago, I had a client that called, the daughter-in-law called about a mom with mild dementia starting the process, and so that's how they found me on Google. And so the first thing they said, she loved dogs, so I happened to know someone that had a service dog, and so this started. So we have brought the service dog for like 15 minutes into the house once or twice a week. And because the service dogs need to work, this is a value to a lot of people. I mean, it just mentioned that it's great, and because the dogs aren't working, they need to be working and getting the pet and everything, and then just sitting with somebody. The client that we had took the dog out, fed the dog. The dog does little tricks. It was a tiny dog, so the whole thing was better than any doctor or anything else for depression, because we're coming into that in all facilities at home and everything. That's going to be a big area. So, so thanks for bringing that up, because here we were, a great story.
Who would have thought of that?
Yeah.
Who would have thought of that part of the pandemic affecting the service
and
dogs?
we usually, the first thing we talk about, and at the facility like that too, is there's artificial cats and dogs.
Yes.
And so I have a caregiver whose mom's in Pennsylvania and had to take away the cat. She was in a facility, and so we got her one of the artificial cats. And she does not know the difference, but that's not the point. It does things, and it meows, and it pets and everything like that. So here's a real dog. So that was it. Yeah. I
had an instance. One of our residents had one of the artificial cats, and I was walking down the hall and I heard her talking to it, and it was just such a sweet moment. And she was kind of quiet, kind of kept to herself, and she really opened up. So I walked by and I went in and I said, "Oh, what a nice little cat." And she looked at me. She goes, "It's artificial, right?" I said, "Okay."
If you need a real cat, I think Lynn can hook you up.
Yes, I can.
She does. I understand that too. I know Lynn for a long time.
Yes.
I know the cat lady of Atlantic Beach on that.
That's right.
That's who she is.
Thank you for not putting crazy in there.
Well, it stands alone, doesn't it?
Yes, it does.
Well, Pat, in normal times, and we'll get hopefully soon rather than later into a new normal when children of elderly parents contact you, is it a face-to-face meeting that
I try to get first? It starts on the phone,
possible.
And then I have to meet face-to-face. First of all, if I'm going in the home, I can see that quickly what needs to be, especially if they're staying in the home. The other thing we have to talk about is finances, and how can we afford? People are like, oh, there's big bucks involved in that, and to get. I don't spend a lot of time on that, but if they need a financial advisor, if they need estate planning or anything, that's another thing they have to do. Look up, I start with the paperwork, and do you have the money? Is there a long-term insurance? But also the health of the person, and do you want to keep them at home or whatever? And then the plan goes by me talking and listening to them, and I just say, we'll start with this, such as the service dog. That's how I started with that. And that way they've introduced me to the family. This client that I'm talking about their children live in Raleigh, but they're in there, and the father had just a medical issue. So the whole thing started, and we'll see where they go when it gets not safe at home and they can't stay at home, and bring in, I always bring in license, because I don't want to be the one that says I'm bringing someone from the street that I don't know into the home. So everything I do is licensed. Then I get to know the personality. Then I go, okay, they have to move on. They're good for Carteret Landing or in-home. I need this agency. So I have it's no pay, nothing. It's just free. I like that part. I mean, I don't have to answer to anybody when I use any of my deals where they have this in Florida, but not here at all. And Florida has a lot of them, and they are paid. These people like Carteret Navigators are paid by the
facilities.
Yeah, and that. So I'm broad, so I can get in there and get anything. You need a bar, I know someone that can put up a bathroom bar. It just goes from the little to the bigger. And
truly the navigator.
Yeah, so I navigate everything.
Navigator, facilitator, any of those types of modifiers.
So it's just like really something in the middle. It's not.
Right.
on that. So
We're talking with Lynn Schultz from Carteret Landing, and also joined by Pat Wesson. Pat is the original Senior Moment on air personality here at the radio station and she was at another company, but now is with Senior Resource Connections. And I would imagine, Pat, the way you describe this, you have more or less, I won't say a script, but in your mind, when you approach somebody for the first time, you know the steps that you're going to take.
Right.
But when you get with those individuals, it's not a one size fits all, is what I'm trying to say.
Oh, no,
each situation is unique,
exactly.
but
that's
it
why
takes
so many resources, and it's an ongoing process also, as the client gets either worse or better or whatever happens. And so we might be in for 2 weeks because the caregiver had to leave or whatever. But there's another area, if we have a minute, that I think needs to be addressed big time, and that's called elder orphans. There's 14 million elder orphans or solo agers in this United States, and I'm an elder orphan. I have, my spouse is deceased. I don't have any family in the area. I mean, thank God I have good friends, and I know the healthcare industry for that part of it. But there are so many that come up through the baby boomers that didn't marry, maybe didn't have children, the divorcees. And what happens is they have no idea what happens when they go into a hospital, say to have a knee replacement, and then before they can be discharged, they say, oh, you can't go home unless you have help at home, or you can go into a facility, but if they certain want to go home for a while or whatever, so they're there, what do I do, who do I go? And the hospital can give you some, but license agency or that, but if they just want somebody to bring them because they have a medical procedure and somebody has to stay for 24 hours and they don't have family. So I find that a big area that I work with a lot, that a senior themselves, as they know, they start going up the track or down the track of life. The journey changes with that. So we need to address the elder orphan area and the solo agers and get them communicating with us and vice versa.
Let's hold that thought. We'll take a break here and we come back, and maybe we'll talk about some of the top things that a senior orphan, am I saying that right? An elder orphan.
It's a bad name, but solo agers
there you go.
should probably have in place now, and maybe we'll discuss that when we come back. We're talking with Pat Wesson and also Lynn Schultz from Carteret Landing. If you want to reach Carteret Landing, go to ridgecare.com for more information, or call them at 773-0980. We'll be right back after this.
Hi, this is Lynn Schultz from Carteret Landing Assisted Living and Memory Care. Our team members have worked diligently and bravely on the front lines of COVID-19. They're the heroes you want on your side, whether you're facing a global pandemic or experiencing the daily struggles that come with age. In the good times and the bad, Carteret Landing is the senior care partner you can trust. Please give us a call at 252-773-0980.
In over 30 years of practice and 15 years on the radio, the respected law firm of Harvell & Collins has demystified the law with a professional and compassionate touch. Cecil Harvell and Wes Collins, along with associates Andrew Foster, Sam Morris, and Julie Sakeley, practice in all areas of civil law, including estate planning, estate-related matters, tax law, elder law, collections, and foreclosures, as well as civil trial practice in these and all other civil matters. Learn more online at harvellandcollins.com and call to arrange your free initial consultation at 252-726-9050. Plus, Cecil Harvell and Wes Collins answer your questions live each Tuesday morning at 7:30 on Let's Talk Legal on the Talk Station.
I just want to thank them for all the great legal advice I've gotten from listening to this program. I called about a year ago about my mother who had no will, and you were such a big help to me. You have no idea.
For the right advice at the right time, call on Harvell & Collins, Attorneys at Law, 1107 Bridges Street in Morehead City.
Are you prepared financially? Hi, I'm Greg Hicks.
Join Greg on The Greg Hicks Show, Wednesdays at 7:30 on FM 107 and AM 1240.
Whether you're newly engaged or celebrating a milestone anniversary, marriage brings a whole host of financial issues. Join us this week as we discuss the impact of money on your marriage.
Securities offered through Capital Investment Group Incorporated, 100 East 6 Forks Road, Suite 200, Raleigh, NC 27609. Member FINRA SIPC, affiliated with Capital Investment Advisory Services, LLC.
Have you wanted to speak a new language, but you thought it'd be too hard or take too much time? Then go to Babbel.com, download the app, and try it for free. In just 15 minutes a day, you'll be on your way to speaking a new language in just a few weeks. And right now, you can try Babbel for free. Babbel starts out teaching you words and phrases by matching them with pictures. You won't believe how easy the interactive program is. Soon the sentences get a little bigger, and before you know it, you're having simulated conversations voiced by native speakers. And because Babbel is crafted by language experts and uses the spaced repetition method, in just 10 to 15 minutes a day, you'll be speaking the language of your choice with real confidence. With Babbel, you can speak a language. Just go to Babbel.com and start your first lesson in the language of your choice for free. Download the Babbel app or go to Babbel.com and try it for free. That's BABBEL.com.
Welcome back to our senior moment, and in studio we have from Carteret Landing, Lynn Schultz. And if you'd like to reach her after the show or call now during the show, you can do that too. But the phone number at the office is 252-773-0980. And joining us for this conversation is Pat Wesson. She is Senior Resource Connections, and you can call her at 252-241-2201. Now, Pat, we were talking earlier about elder orphans, but I also want to talk about the support groups that you do. You've been doing this for about 10 years for caregivers, and that can be loved ones, that can be anybody that's taking care of someone. It's a very heavy responsibility to do for anybody, and I'm sure with that comes a lot of challenges, questions, stress, angst, all of the above. What does your support group do, and how does it help?
I'm the facilitator, so I let the group go ahead and talk. And so we don't always want to be whining. Everybody does. We do have to have a little bit of that to go. And after that, we talk about things that are happening in their lives and everything. And we gather, I would say, once a month, when in the normal times at the Senior Center, the second Thursday of the month at 1 p.m. But because of everything going on and the need of the group, most of them have their loved ones in facilities and a few in-home. And I'm really reaching out to in-home caregivers because they need it just as much. We have a couple of them. And so I Zoom right now. I'm Zooming. And if anybody out there is a caregiver of a loved one with dementia in-home or in a facility, they need to join our group. And they can reach me at 252-241-2201. The caregiving support groups are by Dementia Alliance. And out of North Carolina, they're the support that have taught us to facilitate. And because I do it from my heart, because having been there, I pretty well know, and I have no fear of saying anything and everything. And it's HIPAA. We just go in there, and you can say anything you want. It doesn't matter. And we really have had quite a few that say anything that they need, and that's okay.
Yeah,
it's really
that's what they need.
Good. They really need it, and it just they make friends. It's amazing. This group that I have, because people pass on or their loved ones die or whatever, and so I have an ongoing sort of group. This group that I happen to have right now, the best thing was I had 5 men in this group, and that's very unusual because men are not. They're hunters or whatever you want to say. They're not nurturers, and women are. To have these men, we saw a whole different perspective of how they are caring of their wives, and they got really attached to the group and people listening, and they would say anything, you know. It's, when your wife has dementia, I'm going to say this, probably X-rated, but when you have to take a shower, it's not the same when you're 23. And so things like that. So caregiving group is good. You please join and just listen. If you don't want to talk, it's just anything you want to do. And like Lynn knows, I mean, they've come from the facilities and they don't want to leave. It's amazing. We even have a coffee group now with Zoom.
It's a bond.
Yeah, and
it's a true
they
bond.
They have nothing to do with their loved ones have passed on, but they're still tight, and so that's a really good thing. So yeah, you need to come on to the caregiving support groups.
Absolutely.
In any facility, I hope, or anybody out there listening, please call, and I'll set you up on Zoom right now. It's every week we're meeting on Zoom.
You can reach Pat at 252-241-2201. And Pat, you speak from the heart. You speak from experience and passion because you were a caregiver for your husband for 13 years or so. Even despite your length of time caring for your husband, are there things that you pick up and learn during these sessions?
Yes.
And what would some of those anecdotal stories be?
I mean, we talked about we'd get so upset at my husband because he wouldn't hear me through the dimension and not realizing the noise. There is a program that we've all been through, many of us. It's Dementia Live that tells you that's the best thing for anybody if it's still going on, and it's a process. And so I learned that I was yelling at him because he was listening to the TV. He couldn't understand what I was saying, and that would annoy me. I was one of those that I let my anger come out. I mean, I didn't hide it. I have friends that left the room if they were upset. I learned about different protocols. I mean, when it started with dementia 10, 15 years ago with my husband, there wasn't very much out there, and we did not know. Now more and more groups are available. There's more clinics and more medicine, and that's what I learned in the support group, and other people learn, and they share. Oh, go to this one, or why don't you try this? We learned lots of stuff. You've had January Brown on many times, and she does all that Dollar Tree stuff, and I, put the lights out there and things like that. So, it
is important. I think I've mentioned before. I went through it with my mom years ago. I knew nothing about dementia, had no clue. I made so many mistakes, not yelling and getting into fights. You took my money. No, I didn't take your money. Well, now I know. She thought I did.
Yeah.
And it was under the mattress. And why did you put it under the mattress? And I'm like, I didn't. But now I know it's so a lot of mistakes. Reach out to the support groups so you don't make those mistakes.
Yeah, and you're going to make mistakes.
Right.
You're going to do what
That's how you learn.
That's how you learn. So,
correct.
Let's take a short break here. We'll come back with our final segment. We're having a great conversation with Pat Wesson, Senior Resource Connections. You can reach Pat at 252-241-2201. And also Lynn Schultz is joining us, as always, for our senior moment. You can check out Carteret Landing by going online to ridgecare.com or call 252-773-0980. We'll be right back.
Hi, this is Lynn Schultz from Carteret Landing Assisted Living and Memory Care. Our team members have worked diligently and bravely on the front lines of COVID-19. They're the heroes you want on your side, whether you're facing a global pandemic or experiencing the daily struggles that come with age. In the good times and the bad, Carteret Landing is the senior care partner you can trust. Please give us a call at 252-773-0980.
I'm Leon Nafok, co-creator of the hit podcast Slow Burn. I'm here to tell you about a new podcast I'm working on. It's called 5 to 4, an irreverent look at the U.S. Supreme Court.
Sometimes it's important to look back. You need to watch Citizen Kane before you can really understand Avengers: Infinity War.
Every week, Peter, Rhiannon, and Michael are going to take on a legally dubious Supreme Court decision.
I told you guys this, right?
Listen and subscribe to 5 to 4, free.
Like, how simple is that?
Wherever you get your podcasts.
Liberty Mutual Insurance Company helps you customize your home insurance so you only pay for what you need. Unlike things you paid for you didn't need, like the Vacnado 2000. A Wi-Fi connected vacuum that uploads Dust Bunny data to the cloud for real-time optimization. Whatever that means. But really, it's just a very expensive doggy chew toy. With Liberty Mutual, get customized home insurance so you only pay for what you need.
Liberty, 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 liberty.
Only pay for what you need at libertymutual.com.
Dreaming of becoming a professional race car driver? Speeding around empty parking lots is a start, but going pro takes time. So does quitting smoking. It's not about stopping in one day. It's about starting with day one. You just need to take that first step. Get started on your journey toward a smoke-free life with the American Cancer Society. We'll give you the support and resources you need to quit smoking. The finish line is closer than you think. Learn more at cancer.org/smokeout.
I'm a born fishing, yes, I'm born fishing, and my baby born fishing to play the blues.
Hi, this is Dr. Bogus of the Dr. Bogus Fishing Show, heard live on Coast to Daybreak every Monday morning, 7:30 on the talk station. And now the Best of Dr. Bogus Fishing Show is on every Sunday morning at 6 a.m. Now you can get Twice the Bogus live on Monday morning at 7:30, part of Coastal Daybreak. And the Best of Dr. Bogus Fishing Show heard Sunday morning at 6 a.m. only on the Talk Station.
Welcome back to our senior moment with our friends from Carteret Landing, Lynn Schultz. Lynn, again, you knocked it out of the park, bringing Pat in here. Pat,
absolutely.
It's a pleasure to meet you, Pat. And we just, I think, scratched the surface of all the topics that we probably need to talk about and flesh out here. And we'll bring you back here
absolutely.
On future shows.
Like I said, I think the whole thing is to reach out, because there's so many that just don't know where to start, don't know where to go. And that's what Pat's all about, is helping to tell folks how to start. Just
it's a business.
Right, right.
I don't want it to be big, but it's really from my heart also. So.
But it's the business of life, Pat.
Oh,
and
true.
You know, we all have a birth, we all have.
The earlier you know the journey,
yes,
the easier it's going to be for all of us. Just do the paperwork and put it away. And know where things are. That's
planning, you know, and enjoy life, but have those things in, because you don't know when the moment comes when your loved one is stricken and in a hospital laid up, and then you're asking, what do we do now? But if you contact Pat at Senior Resource Connections, you can
navigate you through.
You get a roadmap.
That's right.
You get your own personal triptych, your own personal roadmap. You know,
on the journey.
On the journey. Yeah. So
that's a new way to put it. I like it.
Yeah, the journey of life. I use that
that's
a lot.
Right.
Life's journey is what it's all about, good and bad.
That's right.
Well, in the few moments we have left, Lynn, how are things at Carteret Landing?
We are doing good.
In this new normal.
New normal. We are doing good. Still, just keeping all our residents happy, and whether it's a Nerf gun fight or a snowball fight or whatever. Ryan Kelly actually sang karaoke for an hour and a half.
I want to hear that.
No.
We need to get Ryan Kelly to do the national anthem. Does he ever do a national anthem for the residents?
You know, he does not, but I think it's a great idea.
We need to put that in the repertoire so that we can play it here on Coastal Daybreak.
Absolutely.
Very good. Ladies, thank you for joining us on Coastal Daybreak and our senior moment, as always, on Friday. Lynn, thank you. Again, Senior Resource Connections, Pat Wesson. Call 252-241-2201 to connect with Pat. And also, as always, for Carteret Landing, go online to ridgecare.com or call Lynn Schultz, the Vice President of First Impressions. You see her right when you walk in the door, when the doors are reopened.
When they're reopened.
252-773-0980. So there you go. Thank you, ladies.